I'm Sarah Tyers. I'm the MTFM policy lead here at the Innovation Research and Life Sciences team at NHS England and Improvement, and I'm here to talk about the financial processes that support the policy from April. So if I could have my first slide, please. Thanks. So why invest in MTFM technologies? So the policy does not provide additional funding for commissioners or providers, and instead it mandates commissioners to fund the technologies from existing allocations. We heard Matt talking earlier about the criteria that the technologies have to meet to be supported, and we know that technologies bring resource and cost savings that can be used to improve services and improve equitable access across the NHS and avoid innovation postcode lotteries. These benefits are realised in a short period of time, within a year or 3 years, depending on the technology, so systems get a fast return on investment. Next slide, please. So the policy was launched in 2021 during the pandemic, which saw the funding mechanisms that were designed for the policy being paused and funding envelopes took over the place of the national tariff, which made MTFM compliance really challenging. During 2021, the NHS Payment system outlined its objectives to move away from activity-based payments and to move towards blended payments that support integrated care systems. Next slide, please. An initial area of focus for the payment system in 2022 was to develop innovation and inequalities objectives through payment policy. So last year we saw the beginning of the Innovation Payment Advisory Group, which brought together policymakers, clinicians, AHSNs, providers and commissioners to ensure funding wasn't a barrier to the adoption of innovation. And for phase 1 of that project group, they focused purely on the MTFM policy. Next slide, please. A series of engagement sessions were held throughout 2021, and it concluded with a final deep dive to secure the proposals for the 22-23 National Tariff Consultation. Providers and commissioners preferred a pass-through payment approach for the cost of the technologies, where commissioners were mandated to pay from existing allocations. Initial investments and implementation costs were also considered in the scope of the consultation, and these were proposed to be included in the fixed element of the aligned payment incentive and to be agreed locally. Guidance on the MTFM policy payment is included in tariff guidance documents, and the National Tariff Workbook includes a tab in section 14, which shows all 11 MTFM technologies, and they are excluded from tariff and API. So this makes the responsibility of funding clearer for 22-23. Next slide, please. And as you can see from this slide, the proposals were supported by both providers and commissioners. Next slide, please. This slide, which will be shared with you, gives you links to the documents that are available from the payment system team, and which is currently in reconsultation phase, and that consultation closes on the 25th of March. Next slide, please. So now we understand the payment mechanisms. It's key that implementation of the MTFM policy is discussed with your commissioners. The most sustainable innovation implementation happens when all parties appreciate the benefits of the project and are keen to make a difference to patients. The first step is for providers to bring together clinicians, service managers, finance, costing teams, together with your local AHSN, to gather data to understand how services are currently being delivered. So you need to understand how many patients you are seeing and in what setting. What is the cost of the services? How many patients are on your wait lists? Are you holding extra clinics to cope with backlogs? And let the commissioner know you're beginning to consider the MTFM implementation, and for what specialties. The next step would be to consider how MTFM supported technologies can positively disrupt your services. Bring procurement teams also to help with this step, to understand implementation costs, and these are the costs of project groups, IT infrastructures, training. How are patient pathway changes going to be made? Will you be able to free up theatre time for other patients or maybe even other specialties? Will you be able to discharge patients earlier and free up bed capacity, and how will you use that? Are you already using the technology, but could you increase its use? Have you already been using the technology, but it's been a cost pressure to your trust? Have the full service benefits not been realised? The third step is understanding how your services will look in the future. Maybe you'll experience reduced time from appointment to treatment, reduced risks of readmissions, better patient outcomes, and more patients seen for a reduced cost. And by demonstrating this with the Commissioner, it will help ensure buy-in. And this builds a great case for change to deliver faster, higher quality, larger capacity services with better patient outcomes at a reduced cost. Next slide, please. So we have an opportunity to understand the data for the medtech funding mandate implementations, because providers pay for the technologies and seek reimbursement from commissioners. So the opportunity is that we can see the effect of the MTFM in national cost collection data. The national costing methodology, known as the costing standards, have been updated to include medtech funding mandate technologies, and you can find this in Costing Methodology CM21 Clinical Non-Pay. Next slide, please. The MTFM technologies will now feature in the guidance for the 21-22 national cost collection. And being able to identify how technologies are used in local costing data will be vital to understand the long-term benefits they bring to the service. By capturing national data, we hope that this will be used in the model health system compartment that's being developed to enable systems to identify innovation opportunities. This will encourage widespread adoption to improve equity and access to innovative treatment.